Yeah.
Perfect. So we just had a couple questions. So just so everyone knows, when you do your RSVP, you do have the opportunity to submit questions or thoughts or comments. So we did have 3 questions that were submitted. Do you want me to run through those?
Yep.
Okay, cool. So the first one was, knowing that Medicare waiver expired earlier in May, patients now require a 3 midnight inpatient hospital stay in order to enact their benefits. Have there been any adjustments within discharge planning to approach of the placement of patients in a need of a skilled rehab stay? So I guess that's to the hospital. Hey, sorry, Jennifer. Sorry to put you right back on the spot.
No, you know me, I can talk just about anything. We have developed scripting to explain to the patients, if they come into the hospital and are what we call sometimes a social admission. Family comes in and says, we can't take care of them anymore. Or if they came in and they just fell, hurt their ankle, stay one night, go home. Many times in the past, they were used to going to a skilled facility. We have scripting now for our staff that we're explaining that. Our providers have been educated on that scripting, so everybody's saying the same thing. But saying that, as you know, families and everything else, we need your help, because we also are informing them, if we make you inpatient just to go to ABC nursing home and CMS audits that and takes our money back, they take ABC's money back. And then you're gonna pay for the skilled stay. So we are using that terminology. Now, I will say we've had some patients who have elective procedures who had one a year and a half ago, and they got to go to a sniff. They're coming in to have the other shoulder done, outpatient procedure. Well, last time I went to a sniff, I've already called ABC. They said I can come back. No, you can't.
You take credit.
Yeah, you can. And they canceled their surgery because they thought we were doing something inappropriate. So if patients come to you, we ask that you say, if you meet criteria, you're more than welcome.
Thank you, for sure. And I guess before we go to the next question really quickly, if our board can stand up really quick, just so everyone knows who they are. So we have our advisory board that kind of right now is representing different industries. And then Jennifer is part of our hospital board. We also have Ohio Health, Ohio State involved with that board, and Select.
And Ohio Health Rehab.
And Ohio Health Rehab, and Mount Carmel Inpatient Rehab as well. So, but these are our different advisory board. Brooke is our private duty home care lead. Olivia is our SNF lead. Melissa is our part of our executive board. She is our treasurer. And Ashley is our home health lead. And Angie is our NPPA physician services. We're kind of mixing it up a little bit. She's that lead. And then Lisa is our secretary on our executive board. And Dr. Greenstein is our hospice lead. Patrick is our assisted living and independent living lead. And I think that's everyone for right now. Yep. I know we have a couple people absent today too, but yeah, so that's kind of our board. So please reach out to them. We have a couple other things we're going to talk about as well.
All right, the next question was, have we reached out to FMC Madison or Licking Memorial? We have reached out to FMC. Haven't had a response about participating in our organization. We do this on a volunteer basis. If there's a connection or relationship one of you guys have with those hospitals and you want to connect them with us, we'd be more than happy to provide them the resources that we're providing everybody else.
And as a plug for doing your orientation, so you know all the things that we can do or wanting to help with, and just our different parts of our organization that's growing. Because if you're talking to a case manager that's having those types of issues, especially at those outlying hospitals that we haven't really connected with, one, it makes you look really good. But then two, we want to get their involvement because they obviously are taking part of a big part of the population. So
the next question was for Select. Diane, who's on our hospital board, is not with us here today, so we will table that for future. And is there any other questions anybody else has for us while we're here? Okay, I think this is our last slide before our breakout group. So we got about 20 minutes left. Try to advance the slide and see if it,
It did go.
okay,
Fantastic.
Question in the chat box.
Okay.
Oh, perfect.
This page back up.
Oh, fabulous.
Yeah.
Cool.
all right, so,
Can we talk about the round table real quick?
Oh, you know what? We've got these 4 bullets right here too.
Yeah.
So let's jump into those.
Okay, cool.
I'll let you go.
Awesome. So now that you know who your leads are, if that's part of your industry or if you've already met them or not, what we are really focused on with Loca, why we started was to be this bridge of communication and collaboration from all the different providers, not just the liaisons or the admissions people, but the NPs, Valerie, thanks for being here. All of the other people that are here, we want directors of nursing, we want nurses, we want social workers, we want therapists. We want all the community providers because we feel everyone's knowledge, everyone has a different experience, and that knowledge is going to help, ultimately just going to help the patient experience around the board. So what we are doing, we're kind of changing a little bit of what our board is being responsible for. And so we're challenging them and we're going to support them. And I know some of them have already started doing a quarterly roundtable. And so dependent on your industry, if you're in hospice, with Dr. Greenstein's going to lead that. If you're in private duty home care, Brooke is leading it out. She's rocking it out already. Get involved with those. We really are trying to encourage that type of participation because at the end of the day, if you're having challenges or barriers and we don't know about them or something related to the hospital or even something outside of the hospital, coming together collectively to talk about those things and collaborate on those things is what this group was really formed to do. And so that is what we're kind of challenging and focusing on. So stay on the lookout. Some of them have finalized dates and we do have those published on the page or they're about to be published on the page. There's going to be, it's going to be on there, but we're also going to send them out to you. Now that you have your logins, you're going to be part of those specific industries. You'll get those invites. We'll make sure that communication is there. But if you want to be proactive and reach out to your lead that is for your industry that represents them, please get involved. That's our big part. Yeah, Brooke.
Whatever work email.
Yeah, it'll still be associated to that. Yep.
So like the emails. So, it is michael.lochtefeld@loca.org. Unless you are a board member, your email is deactivated. So it's not another inbox for our members. And just know that.
Really for like
it'll
Drive in the website.
correct. Are you sure there's not one more slide?
My face is closed.
Oh, there it is. Okay. All right, so just real quick, I wanted to go over, so the 3-day waiver has ended. These are the 4 big impacts that we've seen. We wanted to share this information out with you guys. I'm not going to go through it line by line, but you're welcome to read through it. The next thing, Candida auris is a emergent breakout that is being seen in the Cincinnati region. It's being seen in the Cleveland region. ODH, the reporting numbers that we have are not very good. They're from March. But the reporting numbers for Franklin and surrounding counties is very low. But we want you guys to be very well aware and educated that this is a significant risk to our post-acute providers as well as our hospitals. We're going to be sending out education that was provided by Premier Health. So we are now partnering with Premier Health. They operate 6 hospitals in Southwest Ohio, and they did a really great education yesterday. There's a recording of it, all the resources from the CDC. We're going to send that out to all you guys. Highly advise that you review those and take the measures that you need to be aware and keep your patients safe. Quick statistics. It's mostly the patients who are morbid or significantly ill. 1 in 3 of the patients that get the infection end up passing away from it. The infection itself can live on a surface for 2 weeks. And so that's what, and it's a contact. So, you have a patient that comes in, somebody doesn't, garb up properly with their PPE. That patient had that infection. That's going to spread throughout your facility like wildfire. So we'll send that information out. I know it sounds scary. It is scary. It's kind of a little bit like, oh, is this like another COVID challenge for us? Yeah. So we'll send that information out. And then the last thing we're going to do here is we're going to I'm sorry. Thank you. So if you're with hospice or assisted living, please follow Jill off to the community room. And if you're with private duty, stay here, or home health, stay here. Other than that, thank you guys so much for coming. Your passwords will be up here if you want to come up and get your password. They will be emailed as well. Thank you. And then we've got breakout groups for the folks that are here online so that you guys can share your information as well. So give me a second here and I will place you in said breakout group. I need the other computer to do the breakout groups. I will be right back. Right. So here the first name and last name and